So in my talk yesterday on how CAR T-cell therapy changed the outcome for large B-cell lymphoma, I in fact addressed 3 points. First of all, CAR T-cell therapy in large B-cell lymphoma was initially explored in large B-cell lymphomas in need of third-line therapy or higher. And there the outcome with CAR T-cell therapy was considerably better in 3 studies with CAR T-cell therapy than what could be expected from the historical controls. And later analysis has shown, and as presented at ASH, that CAR T really delivers a curative potential in this context, meaning that in the long run, about 1 in 3 patients needing CAR T-cell therapy in third line or higher will be cured, and this represents 3 in 4 up to 4 in 5 patients alive after several years with CAR T-cell therapy. The second point was that CAR T-cell therapy further improves the outcome for patients with DLBCL in need of second-line therapy. There we have 3 studies that have been performed, randomized control studies, and 2 of these studies met their primary endpoint, showing that the EFS with CAR T-cell therapy is significantly better than what is reached in EFS with the standard of care being salvage chemotherapy followed by autologous stem cell transplantation. So this was in patients in need for second line therapy and were transplant eligible. Further data have been reported recently showing that CAR T-cell also delivers an improved outcome in patients that are not eligible for autologous stem cell transplantation. And there the outcomes and the short-term overall survival is again favorable and in line with what has been seen in the studies for transplant-eligible patients. There is one study now also published last year that with a longer follow-up has shown that not only the primary endpoint of EFS is met, but also there is a benefit in overall survival of about 10%. And which is really important, which really indicates that with patients needing second-line therapy for DLBCL, it's really important to move to CAR T-cell therapy immediately and not to move to CAR T-cell therapy only after the old standard of care has failed. And the third point is that very reassuringly, what we see in the real world, in the clinical practice of real world, is that the real world practice, the real world evidence really convincingly shows that in real world it's possible to deliver similar results as the clinical trials have promised that the results would be.